before the law, there were a lot of parents that didn't know what to do when their child got a diagnosis of autism spectrum disorders, and they were going to the internet and doing searches and actually giving their children things that could hurt them. There wasn't a lot of information out there on scientifically based or evidence-based interventions. So this law, put money into the development of evidence-based interventions and disseminating the information. And that has had a dramatic effect. And I can tell, there's a lot more awareness. People understand what autism is now. They have a better understanding of what interventions work. There's also a lot more trained health professionals. As you know, the LEN programs provide interdisciplinary training, so it provides training to pediatricians, psychiatrists, social workers, and all of the people that touch children with autism and other developmental disabilities. So because of that training, we have noticed that that kids are diagnosed earlier, and if they're diagnosed earlier, they can get to treatment earlier. If they can get to interventions earlier when they're young and their brain is still developing, the impact is greater, and it really impacts the rest of their lives. The Centers for Disease Control and Prevention, with their whole Milestones campaign, have also helped to train medical professionals and also parents so that they can understand and see the signs of autism earlier. And I think that's really been effective. So we're getting kids diagnosed earlier, getting them to treatment faster. And the NIH is doing amazing work and really understanding the brain and the development, and they're identifying genes